Namaste, I am Dr. Chaitra Gowda, Consultant Obstetrician Gynecologist at Cloudnine Hospital, Bellandur. How common is the bleeding in pregnancy? Around 15 to 25 women out of 100 experience some amount of bleeding in pregnancy. So each trimester has its own significance if you are having bleeding. So in first trimester, if you are experiencing some amount of bleeding, the most commonly it will be because of the implantation bleeding. So implantation bleeding occurs usually around 4 to 5 weeks period of gestation, where the embryo implants into the uterine cavity. Some amount of bleeding for few hours up to 1 or 2 days also it can occur. It is a normal variation of bleeding actually. Apart from that, miscarriage. First trimester bleeding, if the bleeding continues more than 1 or 2 days, chances of miscarriage will be there. Like chance of miscarriage is 10 out of 100. If 100 women is experiencing bleeding in first trimester, 10 women might miscarry. So implantation bleeding and miscarriage you will have to know. And also bleeding in first trimester can be because of the ectopic pregnancy. Coming to second and third trimester, bleeding here can be more dangerous. It can be because of the placental cause, that is placenta previa, that is low-lying placenta, or because of the abruptio placenta, that is separation of the placenta, premature separation of the placenta, which can be a little dangerous to the women. Apart from these pregnancy issues, bleeding can also occur because of the infection in the cervix or a cervical polyp. And sometimes we do not get to find any cause for the bleeding, and then we label it as indeterminate cause. Coming to the treatment, first trimester bleedings, which is caused by probability of implantation bleeding or chances of because of miscarriage, we start supplementation with progesterones and relaxants just to support the pregnancy, and usually most of them will continue the pregnancy well. And coming to second and third trimester, the treatment varies and depends on the cause. So first trimester, if the bleeding is occurring for hours or days, that is okay, it is considered normal. But in second and third trimester, even if the bleeding lasts from 30 minutes to few hours, it can be dangerous. You will be needing immediate medical attention.